Welcome back to Collaborative Conversations. I am Dave Plow, your co-host, and I am joined by your other co-host, IUIP Director, Dr. Barbara Maxwell.
Hi, everyone.
Hey, Barbara. So today we are speaking with IUIPE Curriculum Director, correct?
Yes.
Dr. Zach Weber, and he's going to be joined by the IU School of Nursing's Tanya Coltrain. And Barbara, go ahead and tell me, what are we talking about today?
So today we're going to be hearing from Zach and Tanya about the work they've been doing in embedding interprofessional learning throughout their curriculum for nursing and for pharmacy. They've both done a really fantastic job, and they're going to have a conversation together about kind of the way they've been thinking about that. For Tanya, how they're doing that with very high numbers of learners. And for Zach, doing it in the pharmacy school. He's actually at Purdue University for pharmacy. So as Dave, as you said, our sports rival.
And our interstate rival.
Oh, indeed, even worse. So he's kind of a hybrid between us and Purdue. But the conversation they're going to have today is really about what it takes. I think there's a lot of people struggling with what does it take to not only have a core curriculum, which we're fortunate enough to have here at Indiana University, but what is it to also, on top of that, really get that embedded with your uni professional curriculum? And how can you use other activities, other opportunities that you get within your own curriculum and in partnerships that really matter with others that you're likely to work with in the workplace that can enhance and reinforce and really strengthen that interprofessional learning that the learners have through a core curriculum addressing interprofessional networking, coordination, collaboration, and teamworking. And so both of them have worked really, really hard on that embedding element. And so it'd be great to hear from Zach and Tanya about the processes they've used, because I think they'll be really, really useful to others.
Yeah, and you've done a great job of teeing up what they're going to cover, but I do want to add, this is a very robust conversation, and as a result, they went much longer than our usual episode runtime, so we've actually cut this one up. So it's going to be in two parts. This is part one, and again, since all of our episodes are available right now as you're listening or watching, however you're consuming this product, part two is also available. So if you listen to the end of this one and you immediately want to just go ahead and listen to the rest of their conversation, you can do so. It's part two with Dr. Zach Weber and Tanya Coltrain. Or if you want to break it up, maybe you decide you've heard Zach's voice a little too much and you need something else beforehand, you can listen to any of our other episodes. And with that knowledge, I'm going to go ahead and let Zach take it away from here.
You know, first and foremost, we know that IPE experiences are part of the accreditation standards for many health science professions. And so obviously that gives kind of a programmatic requirement to make sure that we include these for our accreditation standards and to make sure that we're meeting that. But then even within our own programs, we know that, you know, training our students to be collaborative ready team members upon graduation is extremely important because we know that that obviously provides a standard of care that can improve the lives of people and populations in practice. And so just as important as it is from an accreditation standpoint, I think it's even more important just because of the service that we will ultimately provide when our faculty and our students get out into practice and help serve our communities and our patients. And, you know, as you think about the importance of including IPE into our curricula, Tanya, I was just wondering if you had any other thoughts about kind of why it's important to you and to your school and your students.
Absolutely. One thing that I have really enjoyed bringing to my students the whole time that I've been teaching and wanted to get into academia for this reason, to get there a little bit earlier, to help them understand the importance of IPE. I teach in our first semester of the nursing school, and I really impart on them, this is a job you can't do alone. Whether it is nurses with nurses, nurses speaking with physicians, talking with the pharmacy has to get us our medications so we can actually give the medications. The doctors have to write the orders for you to be able to fill them, right? There is literally nothing that you can do in this career without the help of others. I'm happy that the school sees that as such an important part of what we talk about. The American Association of Colleges of Nursing, their new BSN Essentials, actually have a whole section for interprofessional collaboration and making sure that we're meeting those standards. So it's very important to the school. And I also will take an opportunity whenever possible. There's a physician that I work with who really values what education he received from nurses as a new physician on the unit. So he comes and talks to our nursing students, which I absolutely adore. One thing that he really spends a lot of time on is talking about trust. Talking about why it's so important that we not only work together, but trust each other, understand each other's roles, and knowing when I'm going to need help from him, when he's going to need help from me to be able to get things done appropriately. He'll tell this to the students, and I've seen him do it before on the unit. He walks around the unit and he'll, in the morning, kind of look at who's working with him that day and say, oh, Tanya's here. I know that she's going to come to me with any needs, right? So I feel confident in her skills and knowing that she'll reach out to me. This person I don't know as well. And so it's not that I don't trust them, but I need to build that trust and check in on them a little bit more often. So I love that we have that opportunity to have this interprofessional education as students where they can learn to build that trust in a safe environment. And that's really important to me and our nurses who are, kind of jumping in, hoping to build those relationships.
Yeah, absolutely. Thank you. Yeah, and so well said. And I think it's so important to talk about that aspect of trust. And I know even for my pharmacy students, when they're out in practice, is something so important for them to be able to again, be able to build that trust with their colleagues and to integrate into those teams. But I know that it can be a bit of a daunting prospect for them to do that when they're early in their careers and are in the role of a student. And so obviously that just, again, speaks to the importance of why we can help train our students to do that while they're in school. Unfortunately, though, despite that importance, we know that given how hectic and how busy our curricula are for our students, it can be just so difficult to be able to identify how can you even include these types of experiences in your curricula. And so that's what we wanted to talk a little bit more about today, perhaps some of the strategies that we've used within our different programs, for me at the College of Pharmacy and for Tanya at the School of Nursing, of how we've kind of integrated these elements throughout our curricula in multiple places and in different ways. And so I'll just start, maybe Tanya, with you, if you wouldn't mind just sharing a little bit about what does kind of the structure of IPE look like within the different nursing curricula. And I mean that just because I know that you have different degree tracks and programs within your school, you have different admission cycles. And so maybe if you could just provide a little overview of kind of logistically, what does that structure look like for you?
Absolutely. One struggle for us, and it's a good struggle, right, is that we're constantly admitting. So we have admission cycles in the fall and in the spring for our traditional students. We also admit in the summer for what we call our accelerated BSN students. So they already have some kind of bachelor's degree and now they want to get a BSN in nursing as well. So we admit 480 BSN students a year. And that's quite an undertaking, right? So part of what we do is our collaboration with the IPE Center to be able to have those experiences where our students are with other students and learning that curriculum while people that they're going to work with when we all get into the clinical setting. And so that is a big part of how we structure and plan to make sure that IPE experiences are seen throughout the curricula. We also have a class, and it's a class that I teach, and why I love this so much. It's actually called Professionalism in Collaborative Practice, which is just giving us the basis, right? How do we work as a team? What are those team concepts? We talk about team steps, which is a kind of language that we can all speak together, certain tools, certain communication tools that all healthcare professionals can work and learn together. Those are things that we embed right into the curriculum. And then hopefully when they have those solid classes that understand the importance, when we go to these IPE settings and we're with other students, or when we go into the clinical settings and we have our IPE experiences where you're actually in multidisciplinary rounds at the bedside, they're able to see those concepts that we talked about in class or the things that they practiced in their IPE sessions in practice at the hospital setting.
That's great. And I love it how you have those opportunities both in the classroom setting and in the real world practice setting. And I'll just share that at the College of Pharmacy, we really have kind of those same opportunities, but they're just embedded and integrated a little bit differently. And so I think one of the great opportunities we've been able to have there is to actually have IPE-specific classes that are threaded throughout the Doctor of Pharmacy curriculum. And we actually have 5 of those classes with our students participating in one IPE course per semester for the first 4 semesters that they're in that Doctor of Pharmacy program. And so that would be the first and second professional years of the 4-year program. And then they also have an additional opportunity for their 5th IPE class that is embedded within their 3rd professional year. And then, of course, we have some longitudinal IPE assessment and opportunities that happens when they're out on rotations for their final 4th professional year. And so that's been a really great opportunity for us, because I think there's several advantages that we have when you might have that opportunity to have IPE-specific courses, if it happens to fit within your structure. And so for us, it really helps for the students to have a strong, I'll just say, kind of visual element, meaning that they can kind of see these IPE courses on their schedule and on their plan of study. And it makes that piece of IPE just as important, running alongside all of the other pieces that they have within their curriculum, whether it be their other core classes, their elective classes, their experiential coursework. And so again, IPE is another element or another curricular element that runs alongside of those. We also have a graduation requirement, because each of those IPE courses carries a credit load associated with it. And so again, from the student's perspective, they have a graduation requirement that's specifically tied to IPE, and we want them to be able to understand that importance of how that is. And then similarly, it just allows, me as the IPE director to manage a lot of the logistics just a little bit easier, because I can have my own course rosters, I have my own course website, and I have all of those kind of behind the scenes things that allows me to just track the students being enrolled in the courses, the experiences that we offer. And then we also have the opportunity to move both in the didactic space and to work in the didactic space with some of those IPE courses in the P1 and the P2 years for my students. But in the P3 year, their IPE course is actually co-enrolled with their experiential education course or their clinical practice experience that is during that P3 year. And so again, I think it's a great opportunity for our students to see that trajectory of moving from those didactic or classroom-based IPE opportunities to then aligning their IPE experiences with their real-world practice or experiential opportunities. And it just shows that IPE progression and growth across our curriculum. So I think, as you described and as I've been able to describe in our curriculum, there's more than one way to do this, right? We all know that our curriculum are all very unique within our programs, but I think that's so important as you either start or look to integrate or to expand perhaps the integration of IPE within your curricula, is just to think broadly about what that looks like and what structure works best for your program and your curriculum. Is it something where embedding these different experiences within different classes is something that's going to work a little bit better, or could there be the opportunity to add new classes as well? So just something to keep in mind. And I think, again, based on our experience, both of those have been proven very successful for us and our students and our programs. And so when you think about those IPE experiences, there's kind of 2 main types of IPE experiences I'll say that I have in my coursework. And I think, Tanya, I'll be curious to get your perspective on this as well. And that is what I would consider to be kind of your core IPE experiences, and those that would be required for all students to participate in, that provide a lot of foundational elements, foundational knowledge, skills, attitudes, behaviors that we want to make sure all of our students have an opportunity to engage with. But then we also have some additional or supplemental IPE experiences that are available to different cohorts of students for one reason or another, whether it be because of a particular area of interest, because it be maybe that we're limited on size or capacity. And so I was wondering, perhaps, Tanya, if you could share a little bit about kind of what perhaps maybe some of your core IPE experiences versus some of those additional or supplemental opportunities.
Yeah. So I think it's really important that we're able to have some structure, right? Especially when you're talking about students who are admitted all year long and what that looks like, to make sure that everyone gets the experiences that we know are valuable and important, essential to their education. But there are going to be things that arise, and sometimes organically, that are really those defining moments. And I've seen that happen. So from a core perspective, we have our professionalism and collaborative practice course. We have a leadership course where the students are actually going into the environment with nursing leaders. So they will be with charge nurses, day shift coordinators, managers, directors, and they're going to those higher level meetings where they're meeting with different types of professionals. Those 2 things, I think, are, from a coursework standpoint, really valuable to us. And then what we hope that they get, and again, it's Is it going to kind of happen organically? If not, we're going to try to seek it out. Are those moments in the clinical setting, because our nursing students are in that clinical setting so often? Can we have those experiences where they're able to go to a multidisciplinary huddle, or they're able to experience a code where a patient is in distress and they get to see the group of professionals work together? So I love when we have those clinical experiences and then can debrief with them after. So they may not know what they're seeing or really understand the process that they're experiencing, but we can go back and help them to understand everyone's role, or fill in any gaps that they have there. So I love when that happens organically. Part of our capstone, which is kind of the last part of our curriculum, we have the nursing students who are just side by side a nurse at the bedside, and they work their shifts. They're with them for those 12-hour days. They have 12-hour days, 12-hour nights. So they're there on nights. And so they get to experience it all. And we actually have an assignment for them to do that needs to be interprofessional. So those nurses help them find the partners that they would need to complete that project. So I do think that we have that are going to be seen as coursework and are important, but when they can then see that in real life and see that happen, that's when I see it come to life. That's when I hear them say, Tanya, I remember you talking about these rounds and how important they were. And I can see why. Like, I can see that the family was involved. I can see that the physician truly understood the needs of the patient after the nurse explained it. I think those things need to go hand in hand. If we just talk about it, but we don't see it in action, I don't think it brings it home in quite the same way.
Yeah, absolutely. Yeah. And same for our students. And like I said, we have examples of both core IPE experiences and then again, some of those additional opportunities as well. And so for us, really the primary components of those IPE courses that I mentioned are the ones that serve as the core IPE opportunities that are a requirement for all pharmacy students to participate in. And so we can be assured that at least by the time though our students get out into practice, there is some kind of common denominator, if you will, in terms of opportunities that all students will have had by the time they get out into practice. But then again, we certainly have a good portion of our students that have some additional IPE opportunities in a multitude of settings. And some examples of where those things can occur are related to some of the student organizations or professional organizations that we have, not only in the College of Pharmacy, but across campus. They do things like health fairs and community outreach events and other service-oriented projects around campus. And we have cohorts of students that really interact directly with other health profession students that we have around the Purdue campus. So that's kind of an additional experience to build upon some of those IPE opportunities. We've also had experiences over the years that have collaborated with other community partners. And through those collaborations, then we've been able to open up opportunities based on mutual interest and need for students to kind of jump into some of those additional projects. For example, we did one that was centered around HIV/AIDS education. We had students that were particularly interested in that topic area that had a chance to engage within some community organizations that worked in that space. We've had other ones that have done some work within the LGBTQ plus community. We have other students that have a lot of interest in providing service to the LGBTQ community. And so again, that's another opportunity that's an additional experience on top of that. And just as you might think about, integrating these IPE elements across your curriculum, I would encourage you to think broadly about those two elements, meaning what are the core opportunities that if we have the opportunity for all of our students to participate in those, what does that look like and how can we achieve it? Recognizing that it's likely going to involve a higher number of learners and a higher number of participants. And so it's going to bring in just some different logistic considerations compared to some of the additional or supplemental opportunities where maybe the level of learners might be a little bit different in terms of numbers, but at the same time, there's still some logistics and planning to be able to bring all of those partners into one location at the same time.
But what a valuable,
a
valuable thing that we have with the IPE Center at IU to be able to have those big experiences where we do have so many learners, but also we have offerings like the Cycles of Addiction seminars that we have where we bring a panel of people to talk about what happens when families are dealing, not just the patient themselves or the person themselves, but the family is dealing with the issues that surround addiction. That may not resonate with everyone, but for certain learners who maybe don't feel that resonation with something that happened in the big setting, they may say, I know someone who went through this, or this is a topic that's really important to me. Like you were saying, if HIV/AIDS is where you feel like your passion is, what an amazing opportunity to give them those spaces where they can really say, I want to know more, not just because someone's making me, right? Not because it's part of my curriculum, but this is a topic that's really important to me. So I love when we have these different opportunities that maybe will give someone that space to say, now I understand why it's important because it's relating back to something I truly care about.
Yeah, absolutely. I couldn't agree more. And I'll just echo what you said about collaborating with the IPE Center at IU. And so even at Purdue, at the College of Pharmacy, we are very key partners with the IPE Center at Purdue. And obviously they present us with a number of opportunities that we wouldn't have otherwise in terms of being able to expose us to other professions and programs that we might not have at our particular campus location, obviously to help with just some of the development and implementation of different IPE experiences, helping to manage, importantly, some of the logistics of just what does it take to actually pull these things off and to get people together in real time, which is often the most difficult piece of this.
Thank you to Zach and Tanya. And again, like I said at the top of the episode, that was just part one. We're going to go a little bit deeper. We're going to do a little bit more moving into part two with Zach and Tanya. Thank you to both of them for being not just guests, but for being a guest and an interviewer on this episode. It's a very unique way to do a podcast. And I'm just happy that we're able to bring in so many different voices to be a part of this project.
Yeah, it's kind of cool to hear from different people, especially since they're the people doing the work of really trying to embed interprofessional learning into the curriculum.
Yeah, and if you want to hear more about interprofessional education, hear more about those that are working in interprofessional practices, you can do so by visiting our website at ipe.iu.edu. You can also follow us on all of our social medias. We're most active on LinkedIn. Feel free to search us out there. It's the Indiana University Interprofessional Practice and Education Center.
And if you have ideas about things you'd love to hear on a podcast from an interprofessional practice and education center or about interprofessional learning and collaborative practice, then please feel free to email us your ideas at ipectr@iu.edu.
All right, thank you, and we will see you again on the next episode of Collaborative Conversations.